Good evening, one and all. We welcome you all to the National Seminar on Dental Health and Hygiene, Well-being and Sustainable Development 2022, commemorating Azadi Ka Amrit Mahotsav, nation celebrating 75 years of independence, United Nations Sustainable Development Goals, SDGs 2015 to 2030, as part of awareness and campaigns, and international webinar series on holistic health, well-being and sustainable development 2022 in collaboration with Sri Holistic Health Foundation India and Sri Research Institute and Center for Art, Sciences and Well-being. So today we have also a special occasion, that is National Dentist Day and also National Consumers Day. Apart from other commemorations. So before we start our sessions, let's take the blessings of Almighty.
Kurutvam kalyanam arogyam dhana sampadah Shubham kurutvam kalyanam arogyam dhana sampadah Shatru buddhi vinashaya Deepajyotir namostute Deepajyotir namostute Shubham kurutvam kalyanam arogyam dhana sampadah Shubham kurutvam kalyanam arogyam dhana sampadah.
With the blessings of Almighty, we shall continue to today's sessions. Today we have various speakers from across India who would be talking on dentistry, history and evolution, and dental health and hygiene, and various branches and specialties in dentistry and treatment and various modalities, and role of social worker in dental health, and also role of pharmacist, and the role of multidisciplinary team in dental health and hygiene in overall well-being and also sustainable development. So we have Dr. Jyoti Makkar. She is a dentist and also a psychologist counselor from New Delhi. And we have Dr. Vidyahari Iyer. She is a dentist and a woman entrepreneur and multi-personality. She is a classical singer, dancer, and she has published various articles, presentations in various forums. And we have Dr. Sonali Sarkar. She is also a dentist from Chennai. She has also worked as assistant professor in teaching for a couple of years in dentistry and also has other relevant qualifications. And we have Miss Mary Florence Frida. She is professional worker from Bangalore. And we have Manasa from Hyderabad. She is pharmacist. And along with myself, Dr. Ravindraram, moderator and coordinator for this national seminar on dental health, hygiene, well-being and sustainable development. So we welcome you all once again to the national seminar on dental health and hygiene, well-being and sustainable development. So without taking out much time, so we will move on to Dr. Jyoti Makkar for her presentation on dental health and various aspects of dental health and hygiene. Over to you, ma'am, for your session. You can unmute yourself and you can start your presentation.
Jai Shri Krishna and very good evening to all. Before commencing my presentation, I would like to say thanks to Almighty God who granted me this opportunity via this platform. Thank you to the organizers of this platform and sincere gratitude to Almighty and to the platform through which I got this opportunity. My topic of presentation today is dental stains. So, before I start on this topic stains, dental stains, like I would like to say a tooth. Basically, it is composed of various layers. The outermost layer is enamel. Then the inner layer next to enamel is below enamel. That is dentine. Then the inner layer is pulp, and below that is cementum. Now this dentine, it is in the coronal portion also. That is the tooth which is visible in the oral cavity, and it is in the radicular portion also. Now, enamel, it is highly mineralized. It is 95% minerals. And it is the hardest, enamel is the hardest structure of our body. It is even more calcified than the bone. So when we come to dental stains, there are two types of dental stains, tooth stains. One is intrinsic, another is extrinsic. Extrinsic dental stains, they are like which occur due to extrinsic factors. When the tooth has erupted in the oral cavity, the various factors they constitute to the external staining on the external surface of the teeth, like tobacco consumption and cigarette consumption, and it could be chlorhexidine, it could be chlorhexidine, tobacco, cigarette, and there are various things like it could be red wine. Yes, red wine. And it could be due to staining due to too much tomatoes. That can also cause extrinsic stain. Tea, coffee. Yes, tea, coffee consumption can also cause extrinsic stains. And extrinsic stains, they usually, it could be calculus. Yes, calculus. It could be caries, dental caries. That can also cause staining. Now, these extrinsic stains, they are mostly removed by scaling polishing. But if it is due to cavity, then it has to be restored. And if it is due to calculus, that also scaling polishing. Now we come to intrinsic stains. Intrinsic stains, they are the ones which are formed while the tooth is being developed. Now, intrinsic stains, they could be due to certain medications like tetracycline, antibiotics. When the female is pregnant, she is given tetracyclines by the medical practitioner. So that can cause staining, intrinsic stains in the teeth of a child. What happens, this tetracycline, it crosses the placental barrier of the mother, and it affects the skeletal tissues, and it affects the teeth of the child. So this tetracycline drug, it is contraindicated in pregnancy. It is contraindicated in children 8 years and below. So intrinsic stains could be due to fluorosis. Fluorosis is it could be too much fluoride content in community drinking water. Normal fluoride content in community drinking water is 0.7 to 1 milligram per liter of water. But if it exceeds, then it can cause fluorosis. So now fluorosis is also various, it's categorized into various types. Like it could be mild, very mild, moderate, severe, and questionable. So how do we come to know that which level of fluorosis the person is suffering from? So actually, in questionable, they're very mild, very little, tiny spectacles of this white tiny spots distributed in the teeth, and only a dentist can identify. No one else can identify. That is questionable. Then is very mild. Very mild is less than 25%. Less than 25% of white laces or white specks are distributed on the teeth, white chalky surfaces. Then is mild. Mild is less than 50%. Again, white spots. And then is moderate. Moderate is you can say more than 50%, and moderate is white or light brown. But severe fluoresces, actually it may be white, it may be light brown, it may be dark brown patches. And this time in severe fluoresces, all the surfaces of the teeth are involved. Buccal surface of the teeth, that is the portion of the teeth which is towards the cheek. Labial surface, portion of the teeth which is towards the lips. Lingual, towards the tongue. So all the surfaces are involved. So how do we treat it? Now this example which I was saying about dental fluoresces, it is intrinsic stain. How do we treat it? One is porcelain veneer. That is for the that portion. Porcelain veneer is for that portion of the teeth which is only aesthetically visible. When the patient smiles and the patient wants only that portion of the teeth to be treated, not all the surfaces. So that case we go for these porcelain veneers. But if the patient wants all the surfaces of the teeth to be treated, then we go for porcelain crowns. So in that case, what the dentist does, he reduces all the surfaces of the tooth, and then he takes an impression, and then he sends this impression to the lab. And there, the dental technician, he fabricates the crown, porcelain crown, and then it is checked, and then it is seated in the patient's tooth, fixed in the patient's tooth. So then this bleaching is also one of the technique. So bleaching is, it could be in-office bleaching, it could be home bleaching. And depending on the peroxide content, we have to decide that for how much time the bleaching agent is to be placed on the teeth. Then these are, I have discussed tetracycline stains, I have discussed fluoride stains, which are intrinsic stains. Then another is enamel hypoplasia. Enamel hypoplasia, what happens is, enamel hypoplasia, there is, enamel is poorly formed. So enamel is a very, I told you it is the hardest layer of the tooth. So when enamel is poorly formed, it is there pits and grooves in the enamel of a person. So the tooth is easily stained and dentine is exposed. Dentine is exposed, what happens? Sensitivity problem. Tooth is easily stained. Whatever the patient consumes, there is staining in the teeth. And there are fissures and grooves. So these again enamel hypoplasia. In this case also, we the patient like how to treat it. We have to give them the crown, porcelain crown. So another case of intrinsic stains, that is it could be injury. In sports persons, it's quite common that the teeth get injured. So in that case also, we have to go for crowns, porcelain crowns. Then there is pulpal necrosis. These are also intrinsic cause. The tooth becomes discolored. So pulpal necrosis, in this case also, we have to go for pulpal necrosis. We can go for RCT, we can go for tooth crown. So I have discussed about intrinsic stains, extrinsic stains, and with this I end my topic. Thank you.
Yeah, thank you, Jyoti Makkarji. So you have been practicing this profession since quite long, I think. So would you like to give general, dental hygiene? Generally, nowadays we see a lot of lectures even on how to brush also. But, these are certain basic things like we see, lot of these gums, tooth gums are, being damaged due to improper brushing, the kind of things and other happens. So can you share your experience, especially with the children and with these now electronic brushes and other things? Would you like to share some insights on these things in general hygiene?
Electronic brushes, they are basically used by these special kids, who cannot do the normal brushing. Usually brushing is recommended twice in a day, morning and before going to bed, morning after breakfast, and night before going to bed. And we should not do harsh brushing. there are brushing techniques recommended, and modified Stillman's method that is recommended. There are particular techniques recommended in kids. There are particular techniques recommended in adults also. And main thing that has to be taken, that you don't have to do harsh brushing, and you have to use dental floss. And after every meal, you should swish your mouth. You should rinse your mouth after every meal. Then warm saline gargles, that should be done as many times as you can do in a day for healthy gums. And then after every 6 months, 6 months, you should go to a dental practitioner to get yourself checked, because many a times, when the caries initiates, dental cavities initiates, the patient is not able to come to know. But when we go for regular dental checkup, the dentist comes to know, dentist diagnosis. So it can get restored. So every 6 months, 3 months, minimum 3 months, 6 months, you should go to a dentist for a dental checkup, 2 times brushing, and the use of regular dental floss, and warm saline rinses. That's all what I would say. And proper brushing techniques to be followed, because faulty brushing technique can lead to tooth abrasion. And one thing I forgot to mention, in that dental staining, there are medical conditions also, certain medical conditions in which tooth gets stained, like GERD, gastroesophageal reflux disease. In that also tooth gets stained.
Yeah, thank you, Dr. Jyoti ji. And what kind of generally now people, especially the old age senior citizens, keep complaining about this toothache and sensitivity towards this sweet, hot, and other things. So for them, would you like to recommend some suggestions or some precautions where they
Yes.
can manage this pain or dental hygiene?
Actually, in old age patients, there could be cervical erosion. So in that case, we can go for composite treatment. And certain cases, you require RCT also, but we have to take many things into consideration before going for RCT. We cannot just simply do RCT for everything. Whenever a patient comes to you with complaint that there is a toothache, or whenever a patient says that we have to first find out whether it is sensitivity or whether it is toothache. We have to know, because many a times the patient is not able to differentiate between sensitivity and toothache. So we have to locate the source tooth. Where is the problem? What is the cause? We have to locate it. And every tooth pain does not go for root canal treatment. It could be psychogenic. It could be due to stress, psychological stress. It could be due to that. And it could be due to some neuralgia, pain due to neuralgia. We have to locate the source of that pain. And it could be that some other tooth is aching and the patient is telling, it is being referred to some other tooth. The patient is saying that I am having the pain on this particular tooth, and you treat it. But the dentist does not have to listen to the patient. Dentist has to locate that which tooth is actually troubling him. It could be pain from some other side being referred to that particular side. So we have to be cautious. It could be that the patient requires no treatment. It is only psychogenic pain due to stress, but the pain is real. And if it is RCT case, if the pain, if the treatment requires, if the patient requires RCT, we have to take many conditions in factors into consideration. Like we have to see if the patient is not medically compromised. We cannot do RCT in each and every patient. The patient has to be medically totally fit. In medically compromised patient, we will not touch the patient with start doing RCT. We have to take the consent from the particular doctor who is treating that patient. Like suppose it is a cardiac patient and who has gone a recent surgery done, we cannot touch the patient. at least 6 months should have elapsed from that surgery time. And then we have to, after that also, we have to take the consent from the cardiac surgeon that can we touch this patient. There are various things we have to take into consideration. It could be a patient with brain stroke. Then also we have to take the consent of the neurosurgeon. We cannot touch the patient, we cannot touch each and every patient. Thorough medical history should be taken.
Thank you, Dr. Jyoti. And what kind of management or precautions that you would suggest for senior citizens, especially when taking food or in terms of oral hygiene?
I would tell them that brush your teeth regularly 2 times a day, and mouth rinses, and don't take too much acidic food. Anything which causes gastric upset, don't consume such food. Proper diet. And no need to take too much spicy food. No need to consume even too much salty food. Actually, many such senior citizens, they are also suffering from depression and hypertension. So taking that into consideration, I would tell them this.
Okay. Thank you, Dr. Jyoti. Can you share some case studies of your experience of different ages so that we can get some insights? Maybe
Sir, actually, I'm having only 2.5 years experience, and only the patients I have seen in my internship period, and I haven't seen so much because I was given an opportunity only for 2.5 years by great God, and after that I was in this field. So I don't have that much experience. I have not seen that many cases.
Thank you, ma'am, for your humble reply. Yeah. So, how do you see, as of now you are in mental health profession, as we see. So, how do you think that dental health and hygiene is important? How important is it for the mental health? Can you correlate and talk on that? No?
Yes, good mental health is necessary. For a good dental health, good mental health is very necessary. If you have a good mental health, your dental health will also be good. Because stress, if a person is in stress, if he is too much stressed, and then dental pains can also result from too much stress, and periodontitis, gingivitis, they also come according to the stress level of the patient can be suffer from these also. So mental health and dental health is closely related. Good mental health, good dental health.
Okay, thank you, Jyoti, for coming us and sharing your insights, and happy National Dentist Day, and we wish you happy Dentist Day today. And participants, if you have any queries, you can feel free to unmute yourself or raise your hand so that we can unmute yourself and share your observations or any queries. Hope,
Thank you for giving me this opportunity.
thank you. Feel free to share, because nowadays this has been quite, dentistry is also becoming quite popular, and people are also approaching for dentists for various concerns. So I think this is a very good opportunity. First thing is to appreciate their services, which are very much essential in sustainable development or holistic health. And at the same time, it is a very good opportunity for us to interact with them and address, share our concerns also, so that we can get some insights into our concerns, if any. Yeah, you can please go ahead, and if you have any queries, feel free to unmute yourself and ask. Yeah, Manasa.
Yes, sir. A very good evening, ma'am.
Good evening.
Ma'am, is it okay to use the electric brushes twice a day?
Usually electric brushes, they are not recommended, but they are only for the people who cannot handle these normal manual brushes. Usually manual brushes should be used. Electric brushes are for some special children, but that too, they cannot handle it themselves. They need supervision, someone to take care of it. They cannot brush their teeth manually. So electric brushes with supervision by some caretaker. It's used only for special children, as far as my limited knowledge. But for normal human beings, manual.
Okay, ma'am. Ma'am, as all we know, the pulp is the innermost layer of our tooth. What if it suddenly started like swelling, giving pressure the nerves and leads to pain?
Actually, pulp is the innermost layer, soft mesenchymal tissue, which comprises of the innermost layer. If it is approached, if dental cavity approaches the pulp and the patient has pain, we have to go for root canal treatment. Root canal treatment in case of permanent teeth, and in case of these children, if a child faces this problem, we have to go for pulpectomy. That is pulpectomy in deciduous teeth and root canal treatment in permanent teeth. What we have to do is we have to excavate the caries. And after excavating the caries, we have to remove this, we have to do pulp debridement. What is pulp debridement? We remove the nerves, blood vessels, everything from the pulp. And after that, we do cleaning, irrigation. We clean that canal area. Pulp debridement की, उसके बाद we are cleaning the canal area, irrigating and filing, and then we place the medicaments, intracanal medicaments, and after that last is we place the permanent filling material, and then we after that we restore the tooth. Then we do tooth reduction. This is a procedure, and it takes 4 to 5 sittings, and it can take multiple sittings also depending on the condition of the tooth. We cannot say that only in 4 sittings it will be done. It depends on patient's condition, patient to patient condition. Every patient has a different condition. And then after that we do tooth reduction, and then we take the impression and we send it to the lab. Crown is fabricated and we place it there. But this final steps which I have told, no, that crown fabrication and placement of the crown, that is only when the pain ceases. Until and unless the pain ceases, we cannot do these steps. So first thing is that we have to remove the infection from the canal. Many a times there is actually at the apex of the root, there is an infection. There is an abscess, there is a cyst. We have to treat that also. We have to fully disinfect the canal. We have to remove the source of infection. And then only we will go for tooth reduction and crown placement and restoration. It's a lengthy procedure. It takes multiple sittings.
Okay, ma'am. Thank you, ma'am. It's been really wonderful session. Thank you so much.
Thank you.
Yeah, thank you, Manasa, for sharing your observations and queries. And anyone else would like to share your observations or concerns? You can feel free to unmute yourself and ask. Okay, if there are no further
once again, thank you manifolds for this opportunity.
thank you, Dr. Jyotiji, for joining us and sharing your valuable insights. And Dr. Jyoti is also into spirituality. So we have one more query as such if she would like to answer.
Yes, sir.
Yeah, we often talk about this wisdom tooth, na ma'am?
Yes. Wisdom tooth, that is third molar.
Good evening, ma'am.
Yes.
Ma'am, is this wisdom tooth considered under like premolars, molars, canines, or incisors?
Wisdom
Like,
tooth is third. Wisdom tooth is third molar. It has nothing to do with the wisdom. That's just the name given.
okay.
And
What
it
if
can.
grows? Yes, ma'am.
Yes.
Yes, ma'am. Please continue.
No, you ask.
Continue.
I said it can erupt at any age. There is no particular age limit that at this age it will erupt.
Okay. But what if it grows very small?
Actually,
Will we get any?
actually, this tooth does not have any function. Third molar, it does not have any function. And I don't think it will harm you if it is very small or something. The main function is first molar. First molar has chewing function. First molar is the main tooth that is very important in the dental arc. Wisdom tooth, even if it is extracted or even if it doesn't erupt, it does not cause much difficulty. But if it causes pain or something, if there is some problem in it, then you can extract it.
Okay, ma'am. Thank you, ma'am.
But if it is not erupting, one more thing, if it is not erupting properly, like the tooth, it is failing to erupt properly. It is causing pressure to erupt, but it is not erupting. Then that condition, it causes pain. There's a term called pericornitis. That is inflammation in the surrounding of the tooth. The tooth wants to erupt, but is not getting the place to erupt. So that in that particular case, it has to be treated.
Okay. So I hope the tissues in the deeper layers will get affected by this kind of situation.
What happens is there is the particular tooth, wisdom tooth, if it is trying to erupt, it is not getting space to erupt. The tissues, they will become inflamed. There are 5 characteristics of inflammation: rubor, tumor, dolor, calor, functionalisia. So rubor is redness, dolor is pain, calor is again difficulty, and so like there will be redness, there will be heat produced, and there will be too much pain in that thing. Then that has to be treated by a surgeon, one who has specialized in that particular area. Where even a BDS practitioner can do it, but one who has done masters in that particular sphere can do it better. It depends on the skill and the training and practice.
Okay, ma'am. Thank you, ma'am.
Okay, thank you, Dr. Jyoti ji. And thank you everyone for actively participating. Then wish you all the success for all your future endeavors, ma'am, and see you in future sessions.
Thank you.
So we'll just briefly before our next speaker joins us, and we have some more time because that is anyway scheduled at 7 o'clock. So we have 8 more minutes. So we'll just briefly look at into how this oral health is related to sustainable development. Actually, the oral health itself, is very much related to the sustainable development and the sustainable development goals as such. as Sustainable Development Goal number 3, which is related to health. SDG 3 aims to ensure healthy lives and promote well-being for all at all ages. And as we know, these SDGs were established by the United Nations and as part of Agenda 2030 Plan of Action to achieve peace, prosperity, and well-being for all by 2030. Though oral health as such, as a word or as a key term, is not specifically mentioned and targeted in SDG 3, though it is specifically dedicated to healthy lives and well-being. But no, there are various research studies that have given significant connection or impact connection between the oral health and general health or well-being. Often we see these dental health issues or concerns or oral diseases or dental diseases or issues, and they come under non-communicable diseases mostly and have the coexisting modified risk factors. In fact, oral health is also associated with various social, economical, cultural, and environmental concerns. Like often, there is a lot of importance that is given to one smile. Smile is a social communication. In fact, whenever we see someone, our communication starts with a smile, smiling at someone. And what if, our tooth are not, clean or not of generally what is expected of white color, or if they are not properly aligned, or if they are not in proper order, or, the entire smile, in fact, the arrangement of the tooth, teeth as such can influence the shape and size of our, the appearance of our mouth and other facial muscles and expressions. So it also influences the voice and the way, the tone and various other factors, though directly or indirectly. So that makes it very significant that this oral health is also very much related, and it is also influencing the various factors like social, even economical also, at times because of oral health or hygiene issues, where if it is not maintained, there is a burden on the person or on the family for oral care and treatment. And that can also be an economic burden on the family or an individual. And there are certain cultural aspects also, like cultural or religious or spiritual aspects, where healthy teeth or strong teeth or white teeth is also having a significant value. And especially when we are talking about wisdom teeth also, they also have certain significance. Of course, that is beyond science, which is they also serve some purposes, and at times they also have created certain issues. But again, that is not in our purview of discussion as such, but it has on its own significance that maybe if time permits, we can take it up at the end of the session or any other context where we can discuss spiritual aspects of that. So, but we have seen both the pros and cons of having or not having wisdom teeth. But still, this modern research, science research as such, is still in infancy. It's not even 200, 300 years old science. So science is still emerging, and it has a long way to go. So still there are many things. Even there are many, diseases which are which have no vaccines as such. So there are many issues which are not in the purview of science. So we cannot outright reject that this is not science or this is not, science. But what we can say is, with lot of limitations within science, what we can safely say or conclude is this is beyond the scope of science as such, or medicine as such, because we have many times seen, even in spite of having all the efforts put and having so much done, there is still that even as a medical professionals also, we say now it is everything in the hands of God or Almighty. There are many medical miracles also that happened where, and we have seen many case studies or certain cases where everything was quite normal, everything, and we lost them. So there are still certain things that are beyond our scope of understanding and capability. But thanks to the modern science and technology and developments, they are helping us to understand and comprehend and try to explore. So we should have a very optimistic and positive outlook towards such developments. And with that, which provides a vast scope for everyone in a multidisciplinary team to explore various aspects, not only physical or physiological, but also social, emotional, economical, cultural, and also environmental problems. How these issues are causing environmental problems, how oral health or hygiene is related to environmental issues or concerns. By implementation of oral health care or oral health promotion or universal health coverage, recently we had commemorated universal health coverage for all, that is health for all. So uh, that includes oral health and also benefit for general health and well-being. So we can say, taken all together in a holistic perspective, oral health is first step to SDG 3. That is, whatever we consume, we are what we consume, the food we eat, like, and it is through the mouth we consume food. And, definitely it is the first contact with the food is getting in contact with us through mouth. So we can say safely that it is the first contact, and oral health is the first step to achieve Sustainable Development Goal 3, that is a good health and well-being for all. So we'll also take it up. Now it's time for second session, as it's already 7. We'll also look at in detail whenever time permits or the end of the session. So we'd like to invite our next speaker for the day, Dr. Vidya Hari Iyer. She's a dentist and multi-personality resource person, and she has she's a very good classical dancer, singer, and you can see always high in energy, and it is very rare to find her sitting idle or relaxing. Always she is very energetic, and especially she works a lot towards women empowerment, and she has the credit of establishing women dental clinic. And she does lot of initiatives especially dedicated to women, and you can see always carrying a smile which represents the first communication for everyone, and especially dentist. I think that is a way that they communicate, that having a very good smile is very important. And that's why we have to thank dentists for helping us to maintain that beautiful smile on all our faces. It's only because of these, enormous efforts these dentists are putting for maintaining our oral hygiene and health and guiding us. So thank you, ma'am. We welcome you once again to this platform. And we would invite you for your topic on history and evolution of dentistry. And over to you for your session.
Thank you so much, Ravindra sir. Am I audible?
Yes, ma'am.
Okay. So thank you so much, Ravindra sir, for this opportunity. Thank you, Mary, for again, stepping up and commemorating today. I mean, today is a very, very important day for all of us, all dentists in India, as we celebrate the National Dentist Day. So today, the presentation is going to be very, very interesting. Even as I was preparing, I was like, very excited. So I'm sure all of you are going to also be excited to understand how dentistry came into being, and today how is dentistry practiced, right? And I would also, my part of the lecture is going to be only related to history and evolution, and I have my friend Dr. Sonali, who will be taking you through the different aspects or branches of dentistry and what all are the treatment available. So we have divided our session into 2 parts. So I'm going to go ahead with the first session, and I'm going to share my presentation. Just let me know if you're able to see it. Sir, are you able to see the presentation right now?
Yes, ma'am. It's visible. Please continue.
So thank you so much, and welcome again to all of you on this national seminar on dental health and hygiene, well-being and sustainable development 2022. So my topic of presentation is going to be history and evolution of dentistry. And today, as I told you, is Happy National Dentist Day, a very, very important day in our lives. And this is important because it is the birth date of Dr. Rafiuddin Ahmed, whom we call as Dr. R. Ahmed. And he was not only a dentist, he was an educator, a late minister who became a minister in the West Bengal cabinet. And he was the one who first founded the dental college in India, right? And it was named after him, Dr. R. Ahmed Dental College and Hospital, which is right now in Calcutta. And now it is called the Calcutta Dental College. And he was the principal, the founder and the principal till 1950. And he also established the Indian Dental Journal in 1925. And he played a very key role in founding the Dental Act in 1939. And in 1946, he established the Bengal Dental Association, which was further renamed as the Indian Dental Association, which all of us are, an associated member. And I had the privilege of being the president of the Indian Dental Association Madras branch. And Madras branch is the oldest and the biggest, largest in the country. And the government of India awarded Dr. R. Ahmed the Padma Bhushan in 1964. And he is remembered as the father of modern dentistry in India. And in 2016, so you can see just about 6 years back, the Indian Dental Association declared 24th December as the National Dentist Day on his honor. So it's a truly, I feel very privileged to talk about today's topic, especially on this August day. And when you look at Dr. R. Ahmed, he was first elected as the president of the Indian Dental Council, and he also served it from 1954 to 1958. And we learn more about him and what all he did in the few slides which come thereafter. So now let's go ahead to the introduction and the history and evolution of dentistry. So dentistry, as all of you will understand, is a branch of medicine which basically handles the teeth, the gums, the bone, the oral cavity, the joint, and the head and the neck regions. That is the associated structure, and what impact it has on the human body. And oral disease can go way back in time. If you look at the skulls of the Cro-Magnon people who inhabited the earth almost 25,000 years ago, they show evidence of dental caries, just to tell you that, you know, dentists and the dental profession has been there for quite some time, right? And now let's go a little into the history. So ancient dentistry, if you look at it, you know, they used to use something called the bow drill era. So there was a bow and a drill, and that is how the bow used to get inside. And I can imagine it must have been so painful and traumatic, but this was how it was used in the Indus Valley of India. And there were skilled bead craftsmen who created these kind of equipments, and that's how they used it. Then in 5000 BC, you can see in most of the textbooks in Sumerian civilization that tooth worms were spoken as, you know, ones which would cause the dental caries. And in 2700 BC, Chinese had used acupuncture to treat pain associated with tooth decay. And in 2600 BC, the death of Hesi-Ray, and Egyptian scribe, often called as the first dentist, because on his tomb it was written, the greatest of those who deal with teeth and the physician. So that is how dentistry came into being. And if you look at all these old ways of you know, thinking about tooth extraction and tooth pain, you would have heard about that famous quote saying, a tooth for a tooth and an eye for an eye. So extraction of a tooth was supposed to be the most painful. And even in today, if you look at the concept of extracting the tooth, it is equated, especially like how a woman would give birth. So it is equated, the pain quotient is equated to, you know, that kind of pain. So generally, you know, the concept of tooth extraction was more like a punishment given, and these punishments were given in the open arena, usually in the marketplace in olden days. And this was just to, you know, draw a point that, you know, you should not do any harm to people. So that is how the tooth extraction and pain was, you know, kind of associated. And when this used to happen, people used to have some kind of a healing touch and prayers, so that, you know, the pain of that person would be less, or that is how they would be feeling that. Next, in 500 to 300 BC, Hippocrates and Aristotle, they spoke about the eruption of the teeth in a particular pattern, treating the decayed teeth and the gum disease, extracting teeth with a forceps, and using wires to stabilize the teeth, especially when they were loose teeth. So you can see a lot of these literatures way back in 500 to 300 BC. In 100 to 400 BC is the Etruscans of the central Italy. They made a greatest contribution in restorative dentistry, in which you can fill the teeth rather than pulling out the teeth. In the 17th century BC, Edwin Smith Papyrus includes the treatment of several dental ailments. And in the 18th century, the Code of the Hammurabi, which was even associated with the dental extraction, was related to punishment, as I told you earlier. And in 166 to 201 AD, the Etruscans, they practiced dental prosthetics. Like we say, we give caps or crowns, as we call them today, and fixed bridge work. All of that was practiced long back. And then coming to the Middle Age and Renaissance, in 500 500 to 1000 AD, you will see in the Europe, medicine, dentistry, surgery, they were all practiced only by monks. And monks were considered to be the most educated people of that period. And in 1130 to 1163 AD, caregivers were given along with the monks. They both helped together, and they started using some sharp instruments and tools as they would do in any surgical procedures. And in 1210 AD, if you look at it, there were two kinds of people. One were the people who were the actual caregivers, and the other one was the lay caregivers who would come and assist these caregivers to perform routine hygienic services, and tooth and dentistry and extraction, all of that came into that aspect. In modern dentistry, when you look at it in 1530, a book focused only on dentistry, and that was called the Artsnibuslen. So this was very important. And in 1685, a first dental treatment book was written in English, and it was called The Operator for the Teeth, and that was written by Charles Allen. And in 1723, a French physician, his name is Perry Fauchard, and he was called the modern father of dentistry. So you can see his picture here, and he had published a book called The Surgeon Dentist, a treatise on teeth, and that is how caring for the teeth, so prevention of extraction, that was what was followed. And I have been very fortunate to be a Perry Fauchard Academy. I've been awarded the fellowship way back in 2006. So you can imagine, I belong to a part of the PFA Academy of the Indian section. And then in 1785, John Greenwood served as George Washington's dentist. And that's how the public came to understand that dentistry was something which can go on to all the kinds or sects of people. And in 1790, John Greenwood, the son of Isaac Greenwood, what he did was he made a foot dental engine. So now when you actually go to a dentist, you will see some motorized instrumentation. But in those days, a spinning wheel was used to drill the tooth. So from the bow, it came to the spinning wheel to rotate the drill. And this is George Washington's denture in the National Museum of Dentistry. And I was fortunate to go and see this at the Smithsonian's Museum of Dentistry in US. And in 1790, the first specialized dental chair was invented. And you can see this is the Winston chair. And here, the barbers used to use it. So if you look at the initial dental chairs, it used to be like a barber's chair. It was not very comfortable, but it was a place where the patient could sit and drills could be attached and they could work on it. Then it became the enlightening 1800s. So in 1816, Auguste Thavot, he is from Paris, he first developed the first dental amalgam. Amalgam is nothing but a silver filling. I'm sure all of you would have seen these kind of black colored fillings. They were a combination of mercury with other alloys of metal. Then in 1832, James Snell, they invented the first reclining dental chair. Now the chair became a lot more comfortable for the patient, so that was more of a reclining one. In 1839, Charles Goodyear, he had discovered the vulcanized rubber, and thereby the dental dentures, like, the previous dentures which we had were very hard, very stiff, and it used to be made with wood or sometimes even with ivory. So it was very stiff. So from the aspect of the vulcanized rubber coming up, the denture bases became a lot more softer and a lot more comfortable for the patient. And by this time, 1839, you can see that from the higher or the upper class, or only for the who's who or the aristocrats, the dentistry started getting practiced on normal people, on everybody who could afford, right? And 1839 also, we had the American Journal of Dental Science, which is the world's first dental journal, which began its publication. In 1840, the first dental school was found, and Chapin Harris and Horace Hayden, they founded the Baltimore College of Dental Surgery, which is the first school of dental surgery dedicated only for dentists. And this further merged with the University of Maryland School of Dentistry in 1923. And that is how you can see it even today. If you go to Washington, West Virginia, you'll be able to go and see this. And this is one of my trips to the US in 2004, where we are outside the Smithsonian Dr. Samuel National Museum of Dentistry in Baltimore. And you can see that it is called the 32 Terrific Teeth, and that's with me and my friend. And this is the diagnostic kit in the museum. So generally, if you look at a dentist, we use something called the mouth mirror, a probe and a tweezer. So these were the instruments which was displayed there for all of us to come and see. And in 1844, so now you understood that extraction of teeth was a little painful, and people were a little scared, or it was treated as a punishment, right? So now to reduce that kind of a pain, in 1844, nitrous hits the scene, which is the nitrous oxide. And Horace Wells was the first to discover this nitrous oxide, which could be used as an anesthetic medium for the patient so that they would not have any pain. And however, when they started to demonstrate it on patients, so theoretically it worked, but practically when he tried to do it, it did not work. And since it was a failure, nobody wanted to attempt it. However, in 1846, one of his own students, William Morton, he gets the credit of discovering a way and had a successful demonstration of a painless extraction. So thereby, it opened, a room for painless dentistry, or giving an anesthetic solution and then extracting the tooth. In 1848, Waldo Hanshed, they patented the dental chair, the chair like how you can see it today. So it got patented. Next is when we think about dentistry, we all of us will say, okay, there is somebody like, we call patients whom we say that, we have, we do fillings, right? So it's very, very important for us to understand. And Dr. G.V. Black is how we, know this great person. His name is Dr. Green Vardiman Black, and he is called the father of American dentistry. And this, the clinic which you can see in the below picture, it was in 1870, and this is G.V. Black's room where he used to have the dental chair, and he used to practice what we call the dentistry, which is for prevention, which means till that time only extraction was done. But after G.V. Black came, he said, no, we can fill up teeth, and he tried to classify the filling materials and the outline of the tooth that we had to prepare, and thereby he earned the title of the good old man of dentistry. He standardized the rules of cavity preparation and how it is filled, and what he had standardized way back in 1870 is what is taught in dental schools even today. And he developed the principle, what we call extension for prevention. We always say prevention is better than cure, right? So he decided that, you extend the cavity so that you can prevent dental caries. That means you don't have to pull out the tooth. And he taught in many dental schools, and he wrote a lot of articles. And most of the articles, what he wrote is what have turned into several textbooks, which dentists or dental students of today we learn, right? And this is in front of his own clinic, which has been, placed in the museum. And it is so, so beautiful, because in his own handwriting, notes have been kept in this place with his instruments, all displayed. It's just that you can't touch it. So, but it's so beautifully done. Some pictures of him practicing. Very, 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 for me, as a dentist, it was very exciting and nostalgic, both together, right? In 1871, George F. Green invented the first electric dental engine. So till that time, people used to use their hand to go ahead with the motor, and now it had become more electronized. And in 1875, George Green patented the first electric dental chair. In 1884, the first local anesthetic, which was cocaine, which was given, and this was introduced by the anesthetist Carl Koller. And in 1875, we had the X-rays, or the invention of the X-rays by William Röntgen. And thereby, we were able to take X-rays before we went ahead with dental treatment. So with the discovery of the X-rays, we could see to the extent where the dental caries was, and we could prevent. We could do a lot of other treatments to save the tooth also. And because of this invention, William Conrad Röntgen, he was awarded the Nobel Prize in 1901 for his work. However, the intraoral X-rays, or the small X-rays which we generally use for dental treatment, Dr. C. Edmund Kells, he demonstrated the first film which was on a live patient in 1896, after 6 months after the discovery of the X-rays. But then, because they used to take these X-rays over a longer period of time, he had developed cancer in his right hand. You can see the X-ray where you'll be able to see this kind of a growth there for this person, Edmund Kells, and because of the continuous exposure of these X-rays. And that is why today what we do is we try to prevent any kind of untoward reaction. So we give lead aprons for the patients, we keep them on lead sheets, the entire room is isolated with lead aprons, and we also try to see the kind of an exposure rate on the doctor or any other, the technician who takes these X-rays today. Dr. C. Edmund Kells, he was a dentist in New Orleans. He was credited for giving an idea of having something called the four-hand dentistry. See, till that time, a dentist, obviously two hands, right? So only we used to work, but there was no concept of somebody else assisting us. So he was the one who was actually given that credit, and he had a first lady assistance, and he felt it very comfortable, because if there were women coming into his dental office, it became very respected when another woman was already there. So they felt very comfortable when they came into a dental office. And then he soon realized that, his practice was getting better. People were coming. They were more welcome to the treatment. So he said, okay, four-hand dentistry works. So two hands of the dentist and two hands of the assistants. And so by 1900s, he had both a chair-side dental assistant, a woman, and also a receptionist or a secretarial assistant. So he was the one who actually is the first person to understand the need for having a dental clinical setup. And as I told you, we have the dental fillings or the dental amalgam. We can see it in the first picture. They are blackened filling materials. It's a mixture of alloy, mercury and alloys. And then there was an advent of gold filling. So you can see that in the lower picture here. And this gold fillings actually became a lot more comfortable for the patient. The only problem was that color. And then with advancement in the material science, you can see tooth colored restorations, wherein you will not be able to find out which tooth actually had dental caries, and then which was replaced by the tooth colored or absolutely mimicking the tooth structures, right? So what are cavities? Cavities are basically holes or a kind of interaction between the food on the tooth and the microbia or the bacteria, and this attack by the bacteria, which is more acidic in nature, tries to remove some part of the tooth component, and thereby there is wear and tear of the tooth, and the patient starts feeling pain to the level at which the dental caries is. So the dental cavities then had to be removed, and then they had to be filled with a material, and these were the materials which was used. But earlier to this, there were stone chips, turpentine resin, gum, and metals which were used in the patient's mouth. So in 1848, Giovanni Arcoli was the first person to recommend these kind of gold leaf fillings. And then when tooth was removed, so when a tooth was removed, obviously did not look good. So, false teeth was tried to place in those areas where tooth was removed. So when you look back as far as 700 BC, you will see Etruscans, they discovered that, they could use teeth or teeth as like or tooth-like substances. So ivory was used, bone was used, sometimes even bamboo was, tried to be carved into a way to emulate or simulate the lost tooth structure. So from the tooth which was extracted, they try to take all these and place it back into the oral cavity just to have a replacement of that diseased tooth. Then in the scientific advances in the 1900s, in 1903, Charles Lamb devises the porcelain jacket crown, which is the cap which we put after a root canal, or if there is any fracture of a tooth, we try to give them. In 1905, German chemist Alfred Encon introduced Novocaine, which is a pain relief agent, local anesthetics. And in 1929, penicillin was invented. So, after a dental treatment, in case they needed antibiotics, they were able to give it. In 1938, a first dental toothbrush was found, and the synthetic nylon bristles hit the market. In 1945, Grand Rapids, the first city in the world to fluoridate drinking water, so you can bring down the amount of dental caries in a community. And in 1950, the first fluoride toothpaste was marketed. And in 1955, Michael Buonocore, as I showed you in the previous picture, that white colored filling. So with 1955, Michael Buonocore invented that white colored filling materials called the composite resins. And those are the filling materials which we use in our dental practice even today. He also described a method of how this material we could place it on the tooth. So there was something called a resin bonding agent. So you cure it and then you can place this. So nobody can find out that this is a replacement for the lost tooth structure. Then in 1957, John Borden, he invented the high-speed aerota handpiece. Now, these are the handpiece which we use today in our dental practices. And you can see the speed of the handpiece made it a lot more easier and faster, and workability for the dentist to work on the patient. Otherwise, what used to take around 2 to 3 hours to fill, now it is hardly, does take only about 15-20 minutes to do a filling, right? And in 1960, the first electric toothbrush started coming, and the same year, 1960, the advent of dental lasers was produced for soft tissue procedures. In 1970, you will see that the electric toothbrush was introduced into the United States, where people could start buying. And as I told you, we had four-handed dentistry. Now from 1970, from the standing dentistry or sitting dentistry, so that the doctor had a dental chair where he also could sit down and work. And that is how the assistants also were able to help the efficiency of the dental treatments, and shortened treatment time made it much more comfortable for the patients, right? And then coming to the 20th century, these are the forceps, which were, modified forceps were found, and that is how they are used. And most of these forceps are what we use today also in our dental clinics. Next is the 21st century, or the century that we are all living in, right? Today, we have something called the integrating dentistry, and it is with a comprehensive health care. So mouth is the gateway of the body. That's how we say. And a lot of diseases, when you see your oral cavity, you will know everything about your systemic health also. So there is a lot of connection between the oral health and the systemic health. And that is why it's very, very important that importance is given to twice brushing and maintenance of your oral cavity. And lot of knowledge, lot of studies, lot of dental schools coming up, lot of dentists practicing. All of this has created a lot of awareness amongst the general public, and that is how dentistry today, if you look at in the professional world, is rated at one of the top three professional, kind of professions in the country and in the world also, right? And you can see today with a lot more of artificial intelligence coming, dentistry has become much more painless. And not only from the individual dentists, we've also moved on to community-based dental services also. In 1990s, of course, a lot of stress was done on cosmetic dentistry. When we say cosmetic dentistry, it is for you to look good. When you smile, your smile design. So today, nobody calls us a dental surgeon. We are all smile designers, right? We help you smile better, and thereby it increased the popularity of veneers. Now, veneers are something like how you would have a nail polish. So something like that on your tooth, we can place it. They can be very thin, and you can place that, and you can have something called bleaching or tooth whitening. You can have dental implants. Like generally we say there are two sets of teeth, right? Primary and secondary. When you lose your secondary tooth also, and then you feel like you're not able to eat properly, you're not able to talk properly, your aesthetics, your smile has lost, you can place a third set of teeth called the dental implants. And then we have also nanotechnology coming up with a lot of nanomaterials, which is also aiding to give the patient the best smile. So here you can see this patient where they had, a compromised smile in the first picture, in the before, and in the after, you can see with a set of good teeth with the support of implants. So, this aspect is very close to my heart, because being a woman, how did women enter this male-dominated profession, right? So in the 18th century, none of the dental schools would accept a dental, a dental graduate or a person who would come as a woman, right? And Emmeline Robert Jones became the first woman dentist in the United States. She was just 17 years of age, and she went to work with her husband, who was also a dentist, and he was the one who trained her in his office to become a dentist. And then she became a person to open her own dental practice. And there are three famous female dentists who made history, and it is very paramount that we know about them. One is Emmeline Robert Jones. As I showed you in the previous slide, she became famously as the first ever practicing female dentist, and that was in 1855. Next was Lucy Hobbs Taylor, and she also made great waves in dentistry because she became the first woman to actually receive a doctorate or graduate out of a dental school. That was in 1866. And Ida Gray was the first African American woman to become a dentist in the United States. So this was in the US. And in 1917, Irene Newman became the first licensed dental hygienist. A dental hygienist is the person who helps or assists the dentist. So in 1917, she became that extra two hands for the dental surgeon. And within that, so after she graduated, within around a few years, you will see so many more dental hygienists started coming into being. And many early female dentists limited their practices only to serve women and children. And most of these practicing dentists were all immigrants in the US, right? And Lucy B. Cobbs, as we just spoke about her, she was the first woman to actually, get graduation. And after that, she opened her own dental office in Iowa, and she started practicing dentistry. And it was not a very easy, walk-in for her. She had a lot of struggles, and when she was actually denied admission itself in a number of dental schools. And Lucy Hobbs, as I told you, is the first female DDS, and she became the most well-respected women dentists of her time. And this is no mere feat, because I'll tell you, as you see the slides which come further down, you will understand what Lucy Hobbs Taylor means to all of us. And so when you celebrate women in dentistry, you can see that, Emmeline Robert Jones, Lucy Hobbs, Evangeline Jordan, Ida Gray, Sarah Crott, Leon Vaughn. So many of them have made a mark for themselves in the American, history in women in dentistry, right? Now, female dentists, why they became more popular and how this profession from the male dominated became a women dominated profession is because we have smaller hands, we have gentle hands, and patients started liking this kind of a gentle care and cure kind of a model. And that is why, females started getting into dentistry. And as such, women are supposed to have a lot of patience, they are better listeners, and there's a more of a motherly care. So this nurturing aspect, the patient started liking. And similarly, at the same time, when you think about women in UK, you can see in 1895, Lillian Lindsay became the first qualified woman in UK. And in 1937, 3.2 of the dentists registered were women. And in 1972, this figure had actually gone from 3.2 to 12.8, wherein there was a rise in women in dentistry. And by the turn of the millennium, it was 32% of the UK had dentists, and now they say it has risen from 32 to 37%, and by 2020 that is around 2 years back, almost 50% of the UK dentists were women. So this is the dental emblem. If you look at the emblem very clearly, you can see a triangle, and I will be explaining to you all about this. So this became an official emblem of dentistry in 1965. And this is very important because you have a central figure here. Once you see the central figure, you can also see a serpent next to that, which is intertwined. And this became the Arabic, cautery. And this had a kind of an understanding with the Greek god of medicine. Now, the delta part was for D for dentistry, and the O, like we know the Omicron. Okay, the O was for odent, which is in Greek, it's meant the tooth, and the rest is the leaves, which we'll be talking about that. So in the leaves, if you had seen the leaves, you can see there are 32 leaves. So when you understand that we have 32 teeth, so 32 leaves were given, and there are 20 berries at the end of those leaves. So 20 berries was actually given account for the 20 milk teeth the child would have. So this was basically signifying the permanent and the deciduous teeth. And at the background, you can see a lilac kind of a color, which was the official academic color for dentistry. The letter O was given gold, the letter delta was given black, the cautery had in gold outlined in black, and the leaves and the berries and the serpent merely were just outlined in black on the lilac background. So all this became very official way back, and today also we still follow the same dental emblem. Next is a little history of the tooth aids, right? So the toothbrush, a natural toothbrush was used. I'm sure all of you must be remembering. They used to use twigs in India also. In 1885, the first American to patent a toothbrush was Wadsworth. And in 1938, DuPont is very famous even today. If you go and buy any toothbrush, you will see DuPont bristles. That's how patented it is. That is the kind of brushes and bristles that we say is used even today. They are nylon in texture. And in 1939, the first real electric toothbrush was produced and developed in Switzerland. And in 1961, rechargeable cordless toothbrushes came into being. So basically, these were used by people who could not brush or terminally ill patients. But today you can see everybody uses these kind of toothbrushes. Now, how do I brush my teeth, right? So that might be a question. So you need to go in circular motions, going up to down and down to up, especially on your outside teeth. You need to also brush your teeth on the top by going inside and outside, and then you brush internal aspect of your teeth down to outside. So these are the ways, or the 3 areas of the teeth that's how you need to brush. And you need to also do something called flossing, wherein you have to clean between the teeth. So if you take a tooth, they have 5 surfaces, only 3 surfaces you can brush them, 2 other surfaces, that is the sides, you need to floss them. So if you have only brushed your teeth, that means you can understand you've only done 60% of the cleaning. 40% which should have been done by flossing has not been done so far. And then we also use something called the dental aids or the interdental brushes. I will be showing you how to use them in between the teeth. Now, how do you maintain your toothbrush? Many a times people ask us like, okay, I buy a toothbrush. How do I maintain it? So first thing is, don't use any pressure to brush your teeth, right? So each of these brushes are usually acupressure brushes, where if you actually give more pressure to the brush, your bristles will fray. Next is rinse out your paste completely from your toothbrush. This is again very important. And before you actually start using the toothbrush, wash it nicely, clean it with water, and then place the toothbrush. Many a times a question comes like, how do I place the paste, right? So don't place the paste on the complete length of the tooth bristles. You need to keep it from the end to the end, which is just a kind of a peanut size or a small peanut size of a toothpaste. Next is, you need to keep, after you brush your teeth, you need to wash your toothbrush, shake it dry, and then keep it in a dry box. You can see here, we have shown you these kind of boxes are available. And don't share your toothbrush with any person. And when you fall sick, please throw your toothbrush. And usually you need to use your toothbrush only for 3 months. And every 3 months, you need to have a new toothbrush. And wash your hands before you use your toothbrush. Wash your hands, and then cover your toothbrush when you actually travel, especially when you're traveling outside. You need to wrap it up properly. And whenever you're thinking about having a set of toothbrushes in the same jar, especially if you're 3 or 4 of you belong to a family, you're going to have all the 3 or 4 brushes in the same area. When you're sick, you please try to take your toothbrush away and don't keep it in the same place as the others would be there. Next is the toothpaste. 500 BC, long ago, both in China and India, the toothpaste was used. And in 1824, Peabody was the first person. He had introduced something called the soap inside the toothpaste, so that you could have some kind of a froth when you brush. That gives a kind of a sense of cleanliness. Especially in 1850, John Harris, he added chalk as an ingredient to the toothpaste to give it some kind of a bulk. In 1873, Colgate produced a mass production of the toothpaste, and that was in a jar. And in 1892, Dr. Washington Sheffield of Connecticut, he had got it into the collapsible tube, like how you and I use it today. And he also used emulsifying agents like sodium lauryl sulfate. And this is the same agent today also the toothpastes are manufactured. Next is the dental floss. I showed you the dental floss that we use between the 2 teeth. And this is an ancient invention. Researchers have found that the dental floss in the toothpick grooves were there even in prehistoric humans, right? So Levi Spear Parmley in 1790 to 1859, he was a New Orleans dentist who was given the credit for using a dental floss. And in 1815, Parmley, he basically promoted this using a silk thread. And in 1882, the Codman and the Skirt-Left Company of Randolph, Massachusetts, what they did was they had made an unwaxed silk floss. Today, what we get is something called a braided silk floss, and it is waxed also. So this is how a silk floss is there, and you can take up to about 8 inches of the floss. and then you can go in and out by cleaning between the teeth. And when you remove the floss, you bend the floss and then you pull it up. So it's as simple as that can be. Today we have a lot of dental aids which come in packages where you don't even have to put your hand in. You can just push it out and in and then clean it up very easily. And all of us need to use a dental floss, right? And in 1898, the Johnson and Johnson company, they patented the dental floss. Now you can see how once they patent, you can see how it is. So this is how it comes now. You just have to hold it and go in and out. It's very easy. And Dr. Charles Bass. Now, Charles Bass is also the person who taught us how to brush the teeth, the way I showed you earlier, right? So it's called the Bass's method. And he developed the nylon floss as a replacement for silk floss so that it could become a lot more economical for people to buy and use. And tooth flossing or teeth flossing has become a very important aspect of dental hygiene nowadays. Next is a toothpick. In 1872, Silas Noble and Cooley patented the first toothpick manufacturing machine. And today you will see toothpick available everywhere. Our personal recommendation is not to use a toothpick because that creates a gap between your teeth. It lowers your bone. It injures the soft tissue, the gum component. So the ideal way is do not use a toothpick, use a floss instead. And when you use a toothpick, actually there is something called the interdental bone loss. So we have something called a miniature toothbrushes, or we call them the interdental toothbrush. So you can go between the teeth, especially when there's a lot of gap between the teeth, go inside and clean it up so that you will have a healthy teeth around, right? Now, we spoke about, dentistry outside India. So let's come to dentistry in India. So as you all know, as we said, Rafiuddin Ahmed sir, he is known as the father of Indian dentistry, and he graduated from the Aligarh Muslim University in 1908, then went to US and finished dentistry from the Iowa School of Dentistry in 1915. And when he returned to India in 1919, he started his own dental practice. And I spoke to you about how he started dental college, and then he donated his college to the government of Bengal, where he served as the principal. Next is the Dental Council of India. The Dental Council of India is a statutory body, and this is incorporated under the Act of Parliament. The general body of the Dental Council of India, representing the various state governments, the universities, the dental colleges, and the central government. And 1948 is called the Dentist Act, which is followed even today. It is to regulate the dental education in India and upholding the standards of profession of dentistry throughout India. So all through the India, all through all the states, we all follow the Dentist Act 1948, and it is financed by the Government of India and the Ministry of Health and Family Welfare, Department of Health, through the grant in aid. Next is the women dentist in India. So Dr. Vimla Sood from 1922 to 1st of August 2021 was the first woman to become the dentist in India, and she graduated from the University of Punjab in 1944. And Dr. Neelam Andrade is a highly renowned medical expert in the field of oral and maxillofacial surgery, and she became the person who worked during the COVID times. Even though she was a dentist, she was the one who actually formed the hospital in Bombay and started helping or treating patients with COVID. So you can understand today, she's even considered for higher ranks of the Padma Awards, right? So it's very important for us to know how women have risen in dentistry. And this is just to give you a little statistics from, say, 2011 to 2018 to say that the female, induction into the dental clinics and the dental BDS courses has increased multifold. And if you look at the number of dentists, not only in India, but outside India also, if you look at all the countries, you will be able to see that the number of males have actually come down. And overall, internationally also, there are about 85 to 90% of the women who are taking up dentistry. So you can see it's now a paradigm shift from what it was in the beginning to Lucy Hobbs Taylor actually not getting admission in a dental college. Now women actually rule or I can say overrule dentistry, not only in India, but across the world too. A little about general information on dentistry before I pass it on. So when you look at a tooth has various parts. That part of the tooth which is visible in your oral cavity, which you see as white, is called the enamel, and that part which is inside the tooth, inside the bone, is called the root portion, and it has what is called the cementum on the external. Next, you have the dentine, which is there both in the crown portion and in the root portion. And the innermost part of the tooth is called the pulp. That is where you will feel, the pain whenever you have a dental caries or any other problems related to the tooth. So how do we take care of our teeth and gums? So first thing is for you to know that we have two sets of teeth. One is the primary teeth, which comes from 6 months to about 6 years. It is there. The eruption sequence, if you say, is from 6 months to say 2.5 years in a child. And after the age of 6, one by the other, each of these teeth will be replaced by the permanent teeth. The permanent teeth usually starts at erupting from the age of 6 again. You will see the lower teeth coming up first, and then it goes on the upper teeth and the teeth from the front and the back. And slowly these 20 teeth are replaced by the 32 teeth. And usually the tooth eruption for the permanent dentition is from 6 years to 12 to 13 years. And when you look at the wisdom tooth, that is what comes between 17 years and upwards, usually 17 to 25 years. And as I told you, the parts of the tooth, so it is very important for us to respect nature and take care of the teeth as much as possible, because once you lose your tooth structure, you're not going to get it back. You'll have to visit a dentist to get it treated. So what are the things which are good and bad for your teeth? All of us know it. Bad for your teeth are anything which is sugary in nature, which is more acidic in nature, and which is going to be on your tooth for a longer period of time. What are good for your teeth are going to be fruits and vegetables, green leafy vegetables, lot of milk, lot of cheese, which is going to give you a lot of calcium and minerals for your teeth to grow. So if you look at the healthy teeth, it definitely starts with a healthy diet. You have the basic vitamins, which is very important, especially when the teeth are growing, which is vitamin A, vitamin C, vitamin D, calcium, fluoride, and phosphorus. So the next question is, when should I visit a dentist, right? So we need to visit the dentist once in 6 months. So choose the right time to visit your dentist. And as I told you, when you have any dental issues, don't wait for that to escalate. Try to go much before, so that, a stitch in time saves 9. So whenever you visit a dentist, find out what is the problem, and whether it's a paining tooth or bleeding gums or your teeth are crooked, whatever it is, we have various specialities through which the dentist will be able to help you out. Next is your tongue, which is again a structural component in your mouth. So whenever you have the tongue, you need to brush your tongue, clean your tongue, so that that is also devoid of bacteria. And you need to apply little pressure. Don't apply so much of pressure, because the tongue on the upper surface has papillae. And if you brush very hard, those papillae will die. And they are the papillae which is going to help you taste the food you eat. So for you to understand the texture and the taste of the food, you need to have these papillae, right? And we have stages of caries development and stages of gum disease. These are the two most important dental issues even we face today. And if you look at periodontitis or gum disease, is the #1 disease in the dental arena. So dentistry is definitely one of the highest paying medical professions, and dental specialists and those who own their own dental practice actually make more money than any average person living their life. So being a dentist, if you want to know the pros and the cons, definitely there are lots of pros wherein you make a lot of money, you have a good lifestyle, you have a great balance, you actually relieve people from their pain, you improve quality of life of people, you make them smile, you make them eat better, you make them confident, because when you have a good smile, you make them feel better, self-worth is there. And definitely if you look at the kind of reputation the dentists have in today's society is a lot higher. And today we don't call ourselves dentists, we call ourselves smile designers or smile makeover specialists. And we have relatively better working hours than any other medical professionals. We don't have much of emergencies other than if you are in the oral and maxillofacial surgeon category, and you can own your practice, you have a great work-life balance. However, there are a lot of cons also. So when you think about studying for dentistry today, it's becoming very overwhelming because there is a lot of loans which you need to take to make the profession look better. Here, we cannot just start up like that, because after investing a lot of time and energy and the number of years as we graduate, we also need to know that there are a lot of money is put when we start our own practice, and then we need to build our practice. It is not that it's just going to happen. But sometimes work can be very stressful. I'm sure you all have heard Ogden Nash's statement, which says, some pain is dental and the rest is mental. So there is a lot of mental agony with which the patients come to us. So it's very important for us to be a lot more understanding towards our patients. Patients can come in various aspects, having a number of psychological issues, and we need to calm them and help them have a better treatment protocol. And because we work in a very closed environment, the dentist itself go through a lot of mental health challenges also. And this is a very cute kind of a comedy ad which I just saw, and I thought it would be very nice to end on a very happy note. So here, when you honor a dentist, you generally give a plaque. And if for a dentist, when we say the word plaque, it means food which is caught between the teeth and the gums, and this food which is hardened. We generally remove it, calling the cleaning of your teeth. So it is a great honor to receive this dental plaque. Basically means, in the pun intended. So there are various specialities of dentistry, as I had told you, and which Dr. Sonali will be highlighting. And when we generally say that, mouth is the gateway of the body, we really mean it, because if you're not going to keep your teeth clean, then you could precipitate a lot of other systemic problems like heart disease, strokes, lung conditions, dental caries, bad breath, tooth loss, gum disease, diabetes, and mouth cancer. And we need to understand that these could be comorbidities, especially we want to serve people. So with that, I come to the end of today's presentation. I'm open to questions. So thank you so much, Ravindra Sarji, for this opportunity, and over to you to take it forward. Sir?
Yeah, thank you for the wonderful, very insightful presentation. You have covered from, date back history to present. And we are very fortunate on this day to learn about the history and evolution of dentistry. It was very well presented in a very simple manner that we could easily grasp. And it was a very insightful presentation. Thank you, ma'am, for on this wonderful occasion sharing insights. And participants, if you have any queries, feel free to share. You can unmute yourself or you can raise your hand.
Good evening, ma'am.
Good evening.
Ma'am, what kind of anesthesia will be given to the patient?
Today,
What kind of anesthesia will be given to the patient?
are you asking in today's time?
Yes, ma'am. Currently.
Okay. So it depends. It depends on what problem the patient comes up with. So if you ask me on a very personal level, I would say my rate of giving anesthesia probably in the last 12, 13 years has become only 5 to 10% of my patients get anesthesia, because I am a laser dentist. I don't give injections also, and I have a better healing component. So it depends. And if you ask me what is the kind of anesthesia we generally give for other patients, probably we have something called surface anesthetic gels and solutions. We give a spray or a gel which will numb the area before even we give the shot of the anesthesia. Even in the method of giving anesthesia, things have changed. We have something called a single needle anesthesia, wherein it goes directly into the bone and it gives you a numbing effect, even which lasts for about 2 to 3 hours. So even during the procedure and after the procedure also, there is a lot of anesthetic effect on the patient. So today, the world of anesthesia has actually grown. And for patients who are a lot more stress related or prone to stress, or they have anxiety issues, we have something called conscious sedation, where we sedate the patient so that we make the patient feel absolutely comfortable if they are very stressed about the dental procedures. So it's a paradigm. So you need to tell me a lot more specific what is the problem, and in case anesthesia is needed. Otherwise, as I told you, in lasers, 90 to 95%, I don't give anesthesia. I don't even give an injection. So I don't even give a shot. That is the answer, because we do painless dentistry, right from local anesthetic solutions, which last for about we would term them as a nerve block when it goes for more than 2 hours. If we give anesthesia as an infiltration, which is only localized, that might last you for about half an hour to 40 minutes. And otherwise, you can go in for conscious sedation. So, we have a plethora of options where we can give patients so that they have a comfortable treatment in our office. Did I answer your question?
Yes, ma'am. Ma'am, most of the people may say they are having difficulty in anesthesia, and they say they may get sometimes breathing problem also. They feel nervous before taking this. So how you handle them?
Okay. Basically, if you ask me, as I told you, I'm a dentist. I'm also a psychotherapist and a counselor. So I make my patients feel comfortable even before I put them on the dental chair. So there is something called the white coat hypertension. So people like us who wear the white coat, so anybody who's coming to see us, because they know that they're going to come and see a dentist or a doctor, what basically happens is they get very scared. They say, oh my God, I'm feeling scared. So that is why when they come to us itself, even before they enter our practice, they already have a very stressed kind of an outlook towards the practice. Now, as they come, what we generally do is we do something called talk therapy, or we do something called tell, show, and do therapy. So we talk to them about the procedure. We also show them the procedure. We have something like the audio visual aids, where each of the procedures we try to show it to them, and then only we do it for them. So we have some study cast models and things like that. And that is how we try to work out on these kind of patients. And in worst scenarios, like we are talking about patients who are really stressed, as I told you, we have something called conscious sedation. So it's very important for us to make them feel very comfortable. And today, when we are actually trying to, be more kind of an interactive, and we try to explain everything well in advance, it becomes very easy for the patients to feel very calm. And always, when you have a fixed appointment, your patients will be able to understand that, the doctor doctor has not made them wait. So there are a lot of nuances in this, like, we don't make our patients wait in the waiting room for more than 5 to 10 minutes. So these are things which you can do to help the patient feel better. And in case there is any a chronic, we say acute and chronic. Acute means suddenly the patient comes with pain. Chronic means it has been there for over a period of time where the patient has come. So we try to differentiate between chronic and acute cases, and then give probably something called the pre-antibiotic therapy or coverage before even we go to the procedure, so that the patient does feel comfortable.
Okay, ma'am. Ma'am, most probably many of the patients won't comfortable with taking oral drugs. Do we have any placebo drugs to manage them?
No, oral drugs. Today we don't have any challenges by giving oral drugs. Yes, in some patients who are, who have this excess gagging or vomiting kind of thing, where they take drugs and still they feel that, we give intravenous or injections we give of the same drugs, so that the patients can feel comfortable. Placebo, probably we restrict it only for probably study or control studies, where we have a kind of, we are trying to test the efficacy of that drug. Like if I'm going to say, I'm going to give you a painkiller to see if this painkiller is really having some biochemical reaction on your body versus a placebo. Only in those cases we give a placebo. Otherwise, for patients as such, we don't give placebo. Placebo is given only in trials, in case studies, or when we are doing a study with the patient, and we tell them, like, few of you might be given placebos. We tell them before, but in regular practice, in regular clinical practice, we don't prescribe any placebos. We give proper drugs in case the patients have any kind of pain.
Okay, ma'am. Why toothpaste have loads of ingredients and compositions? Like whenever we see the ads, we'll see we have this, that. Why they dump all these compositions in toothpaste? Why we need these many things? Ingredients, key ingredients.
Okay, so basically, if you look at the toothpaste, the components of a toothpaste, see, you need something called a cleaning agent. Okay, and then you need something which will make your mouth, feel fresh. So there is a kind of an agent which is going to make you the peppermint or the mint or spearmint or something like that is added, so that you feel a nice freshening breath after the procedure. In the Indian mentality, we have a kind of a soapy, frothy kind of a thing. We feel if more the froth, the better is the cleansing effect. So, depending on that, they add the ingredient there also. Then we also add some kind of a medicament or medications which are added inside the toothpaste. If you look at people who have sensitive teeth, or people who are saying that their teeth is very weak, so we have some kind of agents where we try to add what is called the reminact or remineralization properties within the paste, so that the remineralization happens. Then there is another aspect where people drink maybe tea, coffee, and have a lot of food colored. Like, see, today when you go to a hotel, your paneer butter masala, when you cook at home versus what you eat in the hotel, it's going to be different, because at home we don't add any food coloring agents, but at the hotel they would be adding some kind of a saffronish, reddish color, so that it's very appealing to your eye. So when you eat all this, your teeth happens to get a little bit of stains, right? So we also add a stain remover or a destaining agent into your paste. So the paste company, just to give you kind of options, right? So they give you mixture of all these, and not one paste has everything. So they will give you different combinations of the paste. And we also have paste which has anesthetic effect, or we add a little bit of anesthetic gel into the paste also, which will make the patient feel a lot more comfortable when they have some kind of a ulcer, or some kind of a sensitive area on their teeth, especially between the teeth and the gums when they have to brush, and if there is some ulcer. So you will see a lot of anesthetic gels which is added in the toothpaste. So if you ask me why they do it, probably to market, because human, we like a lot of variety, we like a lot of color, we feel gel looks good, we want to go back to charcoal, we want to go back to salt. So I mean, it's just marketing gimmicks, if I could answer. Yeah, pretty much the basic ingredients are these. The polishing agent, the agent which will give you a freshening agent, and to add bulk, like you saw the calcium carbonate, or the chalk is added just to give you a bulk to the paste. So these are the basic ingredients, and some preservatives are added. Sometimes a little bit of sugar content is added, so that because they put it on your mouth, they want you to feel very nice. And sometimes a taste ingredient is added, so that you would see pastes with neem or lime or something like that, just to make you get that kind of a good taste in your mouth as you brush. So that's again an evolution of the toothpaste.
Okay, ma'am. In earlier days, we all just habituated to use neem stick directly. So, but for this generation, is it advisable to do? Will it work out? Because we are going with loads of kinds of food varieties nowadays we are eating. So, is it advisable to go and repeat that olden method as a golden method?
Okay, neem twigs, they were used. They had an antibacterial component, which is very good. And today neem is added in toothpaste to give that same kind of a component. However, that was a little bit of more crude way of working. And if you look at the food habits also from yesteryears to today, yesteryears we used to chew, bite, eat. That is how it was. Today it is gulp and eat. I mean, nobody has that much of time. They want to put fast food, no? Something that just goes into their mouth and melts and goes down. So the lifestyle changes has brought in a lot of difference. And the tooth twig, if you look at it, the sharpness of the twig can cause gum injury or any soft tissue injury. It could injure your lips, your cheeks, your inner oral mucosa. It could, injure your gums too. So nylon brushes, or as I told you, the DuPont brushes with that blend or the softness or the rounded ones at the end, those are the ones which are recommended today. So I don't know, if you ask me on a personal level, will I go back to twigs? The answer is a no, because they are not, I would not say they are safe enough right now to put it into your oral mouth. Yes, they have this antibacterial component which is there in the twigs, which is very good, but that component is added in your tooth paste and not in the toothbrush. So, and when you look at the size of your toothbrush also, the head, what we call the head, which goes inside your mouth. Yesteryears, the toothbrush used to be very straight, or it used to be like a rectangle. Today, it is more smaller head, so that it can accommodate when you go into the internal aspects of your oral cavity. So the design of a toothbrush has changed. And the flexibility of the brush, so that it can go into the inner parts. And as I told you, the acupressure parts. And all this has been added. So going back to a twig, a neem twig, is definitely a no-no for me. I would still recommend, a toothbrush of a good quality. Of course, when you ask me toothbrushes, you can get from 2 rupees to maybe 50 rupees a toothbrush. So, of course, affordability is one. But if you look at the 2 rupee brushes or anything of a very cheap quality, you might not have the DuPont bristles or the nylon bristles, and the bristles themselves will be very hard. So what you need in terms of brushing your teeth would be soft or medium bristles, not even semi-soft. Semi-soft we generally give only for people who are having some kind of a gum problem or something like that. But otherwise, we give the soft or medium type of bristles for patients, and even I personally use only that. So hard brush bristles will come when you don't buy these kind of patented toothbrushes. So that is where you will see that.
Okay, ma'am. As per your observations, like which is very better advisable, toothpaste or tooth powder?
Yeah, I still remember I also used to use tooth powder when I was very small, very, very small.
Dabur red toothpaste.
Yeah, I mean,
Tooth
we used
powder.
to use, and I used to love the taste of it. I don't know whether I ate it much or I used it to brush much, but then, yes, so that was used. But again, the tooth powder, it is very difficult to maneuver the tooth powder inside, because since it is powder in, in the consistency, it is very difficult to hold on to your tooth brush. So generally, when we used to use powder, we used to add a little water, make it like a paste, and then apply it over the teeth, and then use the toothbrush to clean it. As I told you, today is a time where all of us are moving towards fast kind of an aspect. Like, it's a fast-paced world. Everything needs to be instant. Like, you have your instant noodles. I mean, everything needs to be fast. So I'm not sure how many people have time to use the powder. And so toothpaste is a much more easier way of working. And again, if you ask me, tooth powder versus toothpaste, the more, I would tilt more towards a toothpaste than a tooth powder.
Okay, ma'am. Which is most advisable? Like, it is advisable to use mouth washes and mouth sprays, because now we are getting all these varieties in for marketing strategies. Will we get any side effects after using this?
Very good question. Very good question. Thank you. I mean, you have a bhandar of questions. I'm so happy. So very good. So the first thing is a mouthwash, right? So a mouth rinse or a mouthwash, it has a lot of value. See, we generally use mouthwashes, especially to create a kind of an understanding into the oral cavity that, the bacteria are hidden in the oral mouth, right? So when I take water and I add a little few drops of the mouthwash, and then I nicely gargle with it, I'm trying to agitate the microbia, that is the microorganisms. It could be bacteria, virus, or fungal infection. So I'm trying to actually shake it up, and then when I spit it, and then when I start brushing, it becomes much more effective. So we do use that. Again, in the mouth rinses, we have a lot of medicated mouth rinses, and we add all these medications there because either we wanted to be a drug delivery system, especially we have chlorhexidine mouthwashes, which helps to reduce the kind of infection or control the infection in the oral cavity. And then we also have fluoride mouthwashes. Fluoride, again, brings down the dental caries, especially when people are wearing clips. So we give these kind of fluoridated mouth rinses so that, the tooth does not get into dental caries. And there are some ointment-based mouthwashes also. And most of these mouthwashes are given only for a short period of time. Like when you go to a dentist, they will say, okay, use this, because they they would have done some surgical procedure or something like that, where you would need the use of a mouthwash. Now, if you ask me, am I going to use the mouthwash 365 days for the rest of my life? The answer is a big no. If you're going to use that way, then I would say the best mouth rinse is what you can make at home. It's salt water. So just have a little bit of warm water, add a little bit of salt, and then, nicely gargle. That is good enough. That will not cause any stain or anything in the oral cavity. But as I gave you the initial examples, these, when you use over a period of time, your mouth has something called the chromogenic bacteria. Chromo means color, genic means producing, and bacteria. So when you use these kind of mouth rinses over a period of time, you would have this chromogenic bacteria which would get activated, and your teeth will become a little bit of yellow or yellowish brown, or in some cases even greenish brown. So and this will be very fast. And when you actually ask the patient, they would say, oh no, I don't eat pan, or I don't have so much of tea or coffee and things like that, but their teeth will not be white in color. And that is why, as I told you in the initial the question when you asked me about the toothpaste, I said they add a polishing agent onto the tooth. So these kind of stains which gets formed can be removed by a toothpaste. Now, just to understand this concept better, now when I'm going to brush my teeth, and imagine I'm brushing once a day. Now on the toothpaste, it would be very clearly written that you need to have, it will give you only a 12-hour protection. So which means out of a 24-hour day, you're only going to brush your teeth once, which means the rest of that 12 hours, your teeth is going to be affected by the microbia or the bacteria in the oral cavity. So that is why we insist on brushing 2 times a day. And this 2 times is obviously once in the morning and once just before going to bed in the night. And each time, so in the morning when I brush, it is for 2 minutes, and in the night when I brush again, it's for 2 minutes. Generally we say do a concept of singing happy birthday to you. So when you sing twice happy birthday to you, that is approximately around 2 minutes, and we call it the 2 into 2 pledge, just to help you understand. You need to brush 2 minutes per time and 2 times a day, so that you can keep all your dental cavities and whatever dental problems at bay. So this is the usual slogan. And to understand the concept of, being away, like we say, prevention is better than cure. We also add another tool which says, like, at least once in 6 months, you need to visit a dentist. Again, if you don't have any problems, also you visit, so that, you're on a maintenance protocol wherein you belong to a low risk patient group. Now, when you have a problem and then when you go to a dentist and then they do a treatment, so then you become into the mid risk group. And for people who have some kind of a systemic problems, like maybe diabetes, maybe any other health issues, or it could be anything else for that matter. So all those patients, they become the high risk patients, where they might need to come to a dentist once in 3 months, or once in once in 4 months, and not once in 6 months. So again, your dentist will be the right person to tell you which category you fall under, and you yourself will know, are you brushing your teeth twice daily? Are you a systemic patient? And are you taking any other medicated drugs? So all this will indicate whether you need to visit a dentist once in 6 months or a little earlier.
Ma'am, many people say, like, doing oil pulling and all, we may actually change the facial expressions. But taking this oil and all will may affect the breath or teeth and all?
Oil pulling, there are a lot of research work which is being done on oil pulling, even in the dental aspect. And generally what they say is, there are different types of oil you can use, and it has to be done early in the morning. Sometimes even before brushing their teeth is what they recommend. They ask you to pull the oil into the oral cavity and nicely, squish, squash inside your mouth, and do it so much that, froth comes and then you spit the oil, it has its own effect, and medically it has been proven that it reduces the number of microorganisms in the oral cavity, and it gives you a much better gum health, and the dental caries also comes down to a very large extent. So if you ask me, have I done it? Yes, I have done it, but do I do it on a regular basis? No, I don't. But yes, there is a scientific reasoning. If there are people who are interested in doing it, they can go ahead. There has been beneficial components to that. Yes.
Thank you, ma'am. It's been really insightful and knowledgeable session, and you covered all my answers. Thank you so much. Thank you, ma'am.
Oh, thank you so much for being such an interactive participant. It's a pleasure to answer your questions. Do stay back. I mean, we're going to have Sonali going to talk about the various aspects of dentistry and all the treatment modalities in each aspect of dentistry. So, you will have a much more clearer idea on how things work. And definitely, I don't know which part of the country you are belonging to, but if you go to a dentist, you will be able to, ask your questions and, get your treatment done the way it needs to be done. And even if there is nothing to treat, if you are only on a maintenance protocol, it is always very nice to visit a dentist when you don't have a problem. So if you have small children, say around 2 years, 2.5 years, where the teeth have just started coming in, so you can take them to the dentist at that time, because then, the dental visit is not going to be very scary. So the reason the fear factor comes is only because you delay. And that's why we say dentistry is not always expensive, only your billing makes it so. So thank you so much. And yes, if there are any more questions, I'll be very happy to answer. Otherwise, I'll again give it back to Ravi sir.
Thank you, ma'am. Due to some technical reasons, Dr. Sonakshi is not available today. She has some power cut problem.
Okay.
So if participants are having some more questions, and ma'am is also is able to share some more time, then we can go ahead with your queries. And definitely, I know everyone has one or other query. So don't feel shy, feel free to discuss, share, so that we all can learn from See, so many queries has come up, and we all are learning from these queries and answers.
Sir, can you put me, can you enlarge so that I can come out of this presentation mode?
Yeah, ma'am. Yes.
Okay, sir. Yes, thank you, sir.
Yeah. So
thank you so much.
Thank you, ma'am. It was very insightful session.
Thank you, sir. Thank you so much. Any questions, please feel free to ask. I can probably share with you a lot more insights into the various branches of dentistry and how we work. If that is fine, I'll be there.
Yeah, ma'am. If you can take that also, it would be great.
Sure, sir. I don't have a presentation because I'm taken off guard, but I can probably show you with the models. Is that good?
Yeah, ma'am. That would also.
So just give me a second. I'm just going to take a few models which I have very close to me, and I'll probably share with you a little more understanding of it. Okay, so we'll go step by step just to help you understand the various aspects of dentistry. So I'm going to show you a model. I hope all of you can see here. So as I told you earlier, that 1/3 of that portion of the tooth which is visible outside, like when I say you're able to see the white portion of my teeth. So that aspect is called the crown, and what is there inside is called the root portion, right? So if I'm not brushing my teeth properly, then what happens is I could have something called dental caries. So if you look here, can you see these black spots on the tooth? So these are areas of dental caries, which means, like, cavities have been formed and we need to fill it up with dental materials. Now, when you fill it up with a dental material, which means we generally go in for a tooth colored material, like I showed you in the presentation. Next is, you also have something called senile caries. Now, can you see it between the teeth and the gums? You can see these black areas. Can you see that, this black areas? So this area basically helps you understand that there is a cavity formed between the teeth and the gum on the external aspect. So this is the place where again we do a filling material. In case it's only dental caries, it's only on the external part. Now just let's look at this model to help you understand the parts of your tooth. So you can see here, this is the external part or the enamel part of it. Then you have the dentine part, and then you have the pulp part. So this is the pulp part. Now, when the caries is only on the enamel part or enamel and the dentine part, then it becomes very easy to do a filling done. Now, when it goes towards the pulp, now, depending how close it is to the pulp, we either do a temporary restoration or we do something called a root canal if it has injured into the pulp, or from the pulp even to the tip of the tooth. So just let's look at that. So if you look at the same model, you can see here this red portion. I hope you're able to see that red portion. That is the pulp of the tooth. And imagine your dental caries has gone up to the pulp and to the end of the tooth. That is when we say that, the tooth basically has got some amount of problem. Now, when I say we are going to have a root canal filling done, I'm going to show you a model here. You can see here. So imagine here, can you see the first picture? You can see the caries has gone inside the tooth and into the root portion of the tooth. Now, in this particular scenario, just a mere filling will not be enough. Your doctor will tell you, we need to go into the tooth. We need to clean up this inner portion of your tooth, which is called the pulp. And once we clean that, it becomes easy for you. And how do we clean it? We clean it up with a very small needle. We call it the files and the reamers. We go into the tooth completely up to the end of the tooth, and then we clean it up and then we fill it up. So if you can look at this picture where the filling is done, so you have something called the gutta percha points, which are the inert material. We fill it up, and then you can see here a white colored cap. So we either give a cap in case the tooth is very brittle, we need to do that. So this is for the root canal. So as I told you, it differs. I mean, this is when you are trying to preserve the authenticity of the tooth. Now, imagine you have pulled out a tooth. So you can see here. So I'm just going to pull this out. So you can see here, there is no tooth because it was carried or something. We pulled that out. Now we give a replacement. You can see here 2 screws placed. These screws are called the titanium implants. So we place these implants in the lost tooth structure, and then we give a cap like this. So you can see the cap, which will just go and fit it properly. So the patient, when they bite and eat, they will not have any issues. They will have a complete coverage. And here you can see they have an implant which is inside the bone to support it. And then you have something called the Maryland bridge. So you can see here again in the anterior, the front portion, there's a tooth missing. And this is a bridge with a wing. Can you see the 2 wings on either side? You can see the wings. So we call the Maryland bridge. So we try to conserve the tooth structure as much as possible. And then we give this. kind of a bridge. Next is for impaction. Impaction means we said 32 teeth, right? So if you can look at this tooth here, it is inside the bone. It has not come out yet. Can you see here also there's a tooth which is inside. It's not come out. So for these teeth which have not come out, we do a surgical procedure and then we try to bring out the tooth. So when we extract these teeth are not serving any purposes. So we remove the tooth and we work around. And you can see here, these are the ways, like this is the jaw bone, and you can see this is where we place the implants, and then we place a suprastructure, and then we help them. So these are, if I can say, the basic treatments that we would do. Of course, we place also clips in the oral cavity so that you can have a nice alignment of the teeth. And today we also work on something called the jaw problem. So many a times when you are talking, or when you're yawning, when you open your mouth wide, what happens is you hear a kind of a click here, right? So if you take your hands and if you just place it here, just below the ear. So if you can see the ear, you just place it here. And then when you open and you close, you will feel a kind of a pain, or you will hear a click of a sound. So that means you have something called the TM joint problem. So this joint is a very unique joint, because any other part of the body, if you see the just one area, the jaw moves, right? But here you will see it has multiple movement. It comes forward, like, see, I've brought my jaw forward. I can bring it back, or I can move side to side. And there is a rotatory movement also. So because this joint is very unique, we always work towards it, because if you have any problem here, you will start having a lot of headache. Many times people come up with shoulder pain, backache. Sometimes pain can go down up till your hips also. So it's very important for us to diagnose. And we also work on something called posturology. So the way I sit now, if I'm going to sit like this, with my shoulders straight, back straight, I'm going to have a much better posture. So when I am going to sit on one side, I will not have that correct balance between my teeth, and that will also cause a lot of problems, especially in the dentition. So we work around a lot of cases where we try to help patients understand that basic concept, and then we try to modify their bite so that they are able to bite on either side, that is the right and the left side, equally, so that they have a much better what shall I say, a much better method of biting and chewing their teeth without having any kind of pain precipitating into the other aspects of the body. So if you have any questions on this, probably I'll take that so that it will help you understand it better. Any questions?
Thank you, ma'am.
Thank you, sir.
Generally, we see some certain complaints, especially from mothers and also even certain adults also, that while chewing, they often tend to bite their tongue. So why this happens, and how we can prevent this?
Okay, I mean, when you accidentally bite your tongue, generally people say that somebody's scolding you somewhere, right? But let us look at it on a very scientific way. So we have musculature. The cheeks form a part of the muscle, and then you have your tongue. Tongue is also a very strong muscle, right? So you have the tongue on the internal, you have the cheek and the lips on the external. Cheeks are at the back portion, your lips are in the front portion. So when you see the placement of your teeth, you will see a kind of an arch. I'm not, can you see it's in a form of an arch? So imagine that you have a tongue inside, you have the cheeks and the lips outside. So the teeth are placed in something called the neutral zone. So when I say the neutral zone, which means the interference from the cheeks and the lips and the interference from the tongue is actually balanced, so that the teeth don't get into any of the either the tongue or on the cheeks. So if the teeth are placed a little inwardly, I'm talking naturally, if the teeth are placed a little inwardly, or if your tongue is very large, you will see a lot of imprints of your tongue, of your teeth on the tongue. And similarly, when you see that the teeth are placed a little externally, you will see a lot of bite marks, or the teeth marks on the area of the cheeks. We call it the linea alba, which is in the inner surface of the cheek. You will see a kind of a line which will be exactly coinciding with that level where the teeth, the upper and the lower teeth meet. So is this good, if you ask me? If it is a chronic problem, chronic means it's there for a longer period of time, then we just don't leave it like that. We, if there are any sharp teeth, we try to do a procedure called enameloplasty. We smoothen the teeth so that the teeth are a lot more comfortable. And in case the patient is interested in getting a clip done, so then we suggest that, so that we can bring the teeth much more into the neutral zone. So either the teeth, now if I am a tooth, imagining me to be a tooth, generally we say we have the X and Y axis, or X, Y and Z axis. So if I am the tooth, I can either be front or back. This is one axis. I can either be right or left. This is second axis. I can either be up or down, that is a third axis, and I can also be rotated. So whenever we look at a tooth in the oral cavity, we look at it in all these four axes. So if we find that there is too much of jumbling of these four axes in each of their teeth, that there is a disharmony there, or what we call as a malocclusion, then we are very particular that we inform the patient, and depending on the patient's acceptance, we definitely do a clip. Today there are various aspects of putting clip, and generally it takes around 1.5 to 2 years to get the teeth in a much more comfortable position. And that is how we recommend the patients to go through a process called the orthodontic clip process. Sometimes we extract teeth to get the teeth into alignment. Today, mostly we don't extract teeth. We try to accommodate all the teeth and we give them. And as I told you earlier, when you have a nice set of teeth, it also improves your kind of self-confidence in front of others, because smile is something which is the first thing you would do, right? Whenever you meet a person, the first thing you would do is smile. And if you have a very pleasant smile, then you come across as a very warm person. So it's very important for you to have. Now, if you ask me, okay, people who don't have a great arrangement or alignment of teeth, can't they smile? Definitely you can smile. I mean, there are so many actors, actresses who don't have the best set of alignment of teeth, but then they come across as very genuine people. So again, it depends on your personality, the way you carry yourself, the way you are, the persona of you. So that is, quite debatable. So generally, we, if a patient is concerned by the way they look or by the way they are, so we make it a point to share, our thoughts on that. And it is generally, when we look at it from the scientific point of view and then the aesthetic point of view. So it's more of will it do any harm for them rather than only looking at it from the beauty aspect of it. So I think I answered that question, sir.
Thank you, ma'am. I think from now onwards, people, when it come to aesthetic aspect of, body, then people will now have a second thought of visiting a dentist also.
Absolutely. Mouth is the gateway of the body, sir. I mean, I have had many patients in my practice where we generally tell them, it is very important for you to take care. And I have diagnosed a lot of kidney problem patients, or, patients with diabetic aspects. I mean, we've diagnosed it. They never knew they were diabetic before. So after we do a treatment, we see that, and then we send the patients. If I have time right now, then probably I'll share some testimonials of my patients. They are all in the form of a video, wherein probably you can see, just to help you understand that, as I answered, I think Bhuvneshwari was the one who asked me questions earlier. So I can show like how even without anesthesia, patients have acknowledged the fact that they have been very comfortable, and it has been a lot more comfortable for them during the procedure and even after, because everybody comes with this kind of a fear factor, and this is very important.
Yeah, thank you, ma'am. Yeah, if you would like to share, then you can go ahead.
I can share, sir. If you want, I can probably share the screen right away. I can share the videos. Just let me know if you're able to see the videos and hear the videos. Just give me a second. I will. So I'm going to just share certain testimonials of patients. Since the crowd, I guess, would be mostly English, I'm only going to share English videos. Now, this is about a patient who was unable to speak because he had something called a tongue tie. When I say a tongue tie, it means like, I hold on. My tongue does not come out, and so he could not even lick an ice cream, or he could not use words to have proper phonetics. Phonetics means the power of speech. So I'm just going to show you one video. Watch the video and then we'll talk probably.
Hi, so I just had a surgery of tongue tie. Before the surgery, I had a small muscle which is pulled, small muscle beneath my front of my tongue, where I had pronunciation problems, and I could not lift my tongue out very easily. Like I could come only until here, and then after that it will start paining. But now after the surgery, I can really pull out my tongue.
Up. Mela, lift your, touch your nose.
It's not coming yet because it's very new to me. It's the first time. I've never brought my tongue out this much. So it's my first time in my life, so that's good. Thanks to Meenakshi doctor and Vidya doctor. Yes, and many pronunciations such as sa, ra, ra. I could not say ra. So even three. I used to say in fast conversation. I used to say it as T sometimes. So 3, it's coming. So I feel very happy about it. Thank you very much, doctors.
So as I told you, this was a patient who was unable to speak properly. So we generally think dentists are only associated with pulling out tooth or filling teeth. So I'm a laser specialist. I do bloodless, painless dentistry, and so I work on a lot of other technical aspects of dentistry, wherein I help them. In fact, I change their lives, right? So in this, he's a child, just about 17, 18 years old, and you can see he could not say 3. So 1, 2, 3, which all of us probably, say it without any problems. So I work with children as young as 1 day old, because today with a lot of C-section babies, we see that these tongue ties are there, and the children are unable to breastfeed properly. And today, see, there was a time when there were more than 2 or 3 children in every household. Today, with a lot of infertility cases, and with only 1 child per family, all this becomes a kind of a very emotional bonding. So, the sky is the limit. I have 27 years of experience in dentistry. So if you ask me questions, I'll be able to pull out those kind of videos and try to share with you, just to help you understand our bit of the world and what we do to make a difference in people's lives. I'll show you a few more videos just to draw some point to help you understand. So this is a very elderly patient, and you're going to see what he has got to say.
நான் வந்து டாக்டர் ராமபத்ரன், ரிட்டையர்டு யூனிவர்சிட்டி ப்ரொஃபஸர், ஏஜ் இஸ் 83. என்னோட ப்ராப்ளம் என்னன்னாக்கா, திடீர்னு என்னாச்சு, ஒரே நாளில் ஐ சா த டிஃபரன்ஸ். ஒரேடிய பல்லு வலி ஜாஸ்தியாக போச்சு, என்ன பண்ணுறதுன்னு தெரியல. அப்புறம் டாக்டர் வித்யாஹரி தான் டாக்டர், அதனால் அவர் தான் ரொம்ப நாள் பார்த்துட்டு இருக்கார். அதனால் அவருக்கே வரணும்னு ஒரு நாள் வெயிட் பண்ணிவிட்டு நேற்றுக்கு வந்தேன். நேற்றுக்கு வந்து இந்த லேசர்னால என்னாச்சுனாக்கா, விடு பல்லோட லொக்கேட் பண்ணிட்டு வாங்க. உடனே அது வந்து சொன்னேன். சாயந்தரமே வந்து ஐ குட் see the difference. What was a real great problem for me in the morning suddenly vanished away without my knowing it. அதுதான் பெரிய ஆச்சரியமாக இருந்தது. நான் வந்து ஒரு 10 வருஷம் முன்னால் ஹார்ட் பேஷண்ட்டாக இருந்தேன். அதுக்கப்புறம் வந்து ஐ ஹேட் சம் ட்ரீட்மெண்ட் அட் யுனைடெட் ஸ்டேட்ஸ், ஆஞ்சியோபிளாஸ்டி ஆச்சு. அதுக்கப்புறம் அது போகலை. அதனால் இங்கே வந்து ஃபர்தராக வந்து இங்கே அப்போலோவில் வந்து எனக்கு வந்து இது பைபாஸ் சர்ஜரி ஆச்சு, சிஏபிஜி ஆச்சு. அதுக்கப்புறம் ஒரு 10-15 வருஷமாக எனக்கு ஒன்றும் ப்ராப்ளம் இருந்திருக்கேன். ஆனாலும் இந்த பல்லு ப்ராப்ளம் ரொம்ப நாளாக இருந்துட்டு அது ரொம்ப நாள் ட்ரீட் பண்ணிட்டுருக்கேன். நவ் திஸ் வாஸ் எ ரியல் information for me yesterday. Within a few hours, I got complete relief from the whole thing.
So I'm sorry, this video was half in Tamil and half in English. So he's a retired professor and he had a lot of pain, and I had done an extraction along with lasers, and what he said was what was a problem in the morning turned out to be a boon in just about 2 hours time. He had no pain and he was very comfortable. Just to help you understand that, again, this patient had CABG and he had a lot of heart issues, and still we were able to do that under laser dentistry. So I mean, a lot of patients who got benefited. I'm going to show a few more just to help you understand.
Hi, என்னோட பேர் விஷ்ணு பிரியா. நான் ரீசெண்டா பல்வலிக்காக டி நகர்ல இருக்கிற டாக்டர் வித்யா ஹரி ஐயரோட ஸ்மைல் டென்டல் கேருக்கு போயிருந்தேன். அவங்க எனக்கு ஒரு என்னோட விஸ்டம் டூத்தை எக்ஸ்ட்ராக்ட் பண்ணணும்னு சொன்னாங்க. அவங்களோட எக்ஸ்பிளனேஷன், அந்த ட்ரீட்மெண்ட்டோட எக்ஸ்பிளனேஷன் பண்ணதும் அவங்களோட ஃப்ரெண்ட்லி ட்ரீட்மெண்ட்டும் எனக்கு ரொம்ப பிடிச்சிருந்தது. நான் லேசர் மெத்தடில் தான் அதை ரிமூவ் பண்ணேன். அதுக்கப்புறம் அதோட என்னோட கிளீனிங், ஃபீலிங் எல்லாமே அவங்க இந்த லேசர் மெத்தடில் பண்ணாங்க. எல்லாமே ரொம்ப ஈஸியாக இருந்தது. நான் முதல்ல லேசர் மெத்தட்ல பயந்தேன், பட் ஒன்றுமே இல்லை. அது வலியே தெரியல. இன்ஃபேக்ட் அது ஈவன் வீக்கம் கூட எனக்கு வரல. ஸோ அந்த 24 hours அவங்க சொன்ன இன்ஸ்ட்ரக்ஷன் ஃபாலோ பண்ணதுல ரொம்ப நல்ல பெனிஃபிட் கிடைச்சிது எனக்கு. அப்புறம் அந்த பல்வலி இருந்த இடம் தெரியாமல் போயிடுது. டெஃபினட்டா அவங்களோட ஃப்ரெண்ட்லி ட்ரீட்மெண்ட்டுக்கு முதல்ல நான் தேங்க் பண்ணணும். தேங்க்யூ டாக்டர்.
So here again, Tamil, she says, like, you know, she didn't have pain. I did a lot of fillings and, I did laser wisdom tooth removal. So today, I think, by the pain concept of it, we really work on it to a much easier level, and that becomes very easy for us to help patients and work around patients. So that is the easiest part. I mean, ultimately it is the patient needs to feel very comfortable, right? So that's how I would say. So it is very important that our patients at the end of the day feel happy with our treatment. I think that is the most important aspect of any kind of service. I think the end user or the customer is the king, as what Mahatma Gandhi said. I think that's very, very important. So I'm closing this sharing. In case you have any questions, I can definitely work on it. Yeah. Any questions?
Yeah, thanks for the wonderful testimonial videos, ma'am. And one recent, when I was doing some counseling, I recently got one query from the client that whenever he is talking or suddenly he is getting this saliva, excess of saliva. So what could be the reason? It was not there earlier, but nowadays whenever he is trying to talk, that excess saliva is troubling him. So what could be the reason? Maybe if it is related to dentistry or some other specialty.
Salivary glands, we have three major salivary glands in the oral cavity. So one is the parotid gland, which is the biggest one. We have two on the bottom, and they are the ones which give us the saliva, and usually we are able to combat the saliva. Like I've been talking now for almost 1.5 to 2 hours, and you can see that I'm not been pulling in and out the saliva. It's very it happens very subtly, right? However, there are some people where they have a lot of thick saliva or excessive salivation. Thick saliva is when you are actually dehydrated. You have when they open the mouth like you will see the upper and the lower part, the saliva actually forming a kind of a thin layer, and that is how they have it. And this is especially seen in patients who don't drink enough water, and they have these thick kind of salivas. Now, if there is an excessive saliva, generally it happens just before we eat our food. Whenever you think about food or when you are going to eat food, there's a lot of saliva, because this saliva has a lot of enzymes which is going to help us chew and bite and eat our food better. However, when there is an excessive salivation, just like that, we need to see if there is any other health issues which is there in the systemic aspect, which could have a precipitation of an excessive saliva. We need to look into that and only then come to a solution. It cannot be a generalized thing for everybody. It could be something for that person in particular. So definitely ask that person to get in touch with any dentist. If he's anywhere in Chennai, then probably I could help. Otherwise, wherever he is, ask him to go to a dentist. He will be able to get a much better understanding, because we need to evaluate the patient in totality before we come up with some diagnosis for such patients.
Yeah, thank you, ma'am. I also suggested him to visit an first general physician, then take advice and go to ENT and dentist also, because to rule out all the possibilities.
Yes, I think that's the best suggestion.
So I think anyway, today is a Christmas Eve, so we will not hold on for longer, but the rest of the sessions we can take it tomorrow. I think we also have a conference and hope we all are comfortable. So with this session, we shall conclude it today. And thank you both the speakers for the day, especially Dr. Jyoti Makar and Dr. Vidya Harrier for taking up both sessions, substituting Dr. Sonalia also, and she will be joining. Mary has contacted her and she said she will be happy to join tomorrow. So we can hear to her tomorrow and get more insights. And thank you once again, everyone, and happy Dentist Day. Thank you everyone for joining us. I know this is Christmas Eve time and you all have to celebrate. So we will not hold on you further, and wishing you all happy Christmas also, and happy National Dentist Day to all of you. And kindly join tomorrow also. From afternoon, we'll have one session, first session regarding dentistry, and then we'll move on to further sessions. So thank you everyone for joining us, and thank you ma'am for joining us, and it was really very interactive, and we really enjoyed the session, and you gave really wonderful insights, and hope we have more queries. I think tomorrow, if possible, you can also join sometime. Then if there are any queries, then we can also take it up somewhere before or after Sonakshi's session. Thank you, ma'am. We wish you all the success.
Thank you so much, sir, and thanks to Bhuvneshwari for being that interactive person. She had a volley of questions, and thanks to you and Mary for giving me this opportunity. Thank you so much, sir.
Thank you, ma'am. We wish you all the success.
Thank you so much, ma'am. Thank you. Thank you, sir.
Thank you, dear. Thank you so much.
Thank you, Manasa, and everyone, Bhuvneshwari and all who have posted your queries. And it was really insightful session, and kindly fill up the feedback form before leaving so that we have your details to prepare certificates. Because we have no registration form as such for this seminar, we were using general registration form. So kindly fill up the feedback form so that it will help us to generate certificates. So we have raised the feedback form in the form of polls. So quickly attend to the feedback form so that we know if there are still any queries we can answer. And you can join tomorrow's conference at 2 o'clock with the same link. And you will also be getting another certificate. So that will be a bonus because we could not cover due to technical reason. So you can also get tomorrow's conference certificate. So you happily enjoy the sessions tomorrow as well.
Can I leave, sir?
Yeah, ma'am. Thank you for joining us. And we are just waiting for the participants to complete their feedback so that we'll conclude the seminar. Thank you once again for joining us.
Thank you, sir. Thank you, sir. Thanks to the delegates also for being a patient audience, and wishing all of you Merry Christmas and a Happy New Year. Thank you.
Thank you, ma'am. Good night.
Good night.
Dear friends, feedback form has been shared in the form of polls. If you have accidentally closed the window, you can access the feedback form through polls option. You can see in the menu or options, you can see the polls. You can click on that to access this overall feedback form. So quickly fill the feedback form so that we can get your details for preparing certificate. And tomorrow from 2 o'clock, you can join with the same link. We have conference. I will be sharing that registration form also for tomorrow in the chat box. Tomorrow's conference registration form has been shared in the chat box. And the link is same for all the events. You can save the link and daily you can join us from 6 o'clock on weekdays. On Sundays, you can join from 11 a.m. in the morning. Tomorrow we have a workshop in the morning, 10 to 1. And after that, you can join the conference from 2 p.m. onwards. The link for all the events are same. Daily we are having events from 6 to 8 and on Sundays from 11 a.m. onwards. When there are some special workshops, we are starting at 10 o'clock. Otherwise, on a regular basis, we will be starting at 11 a.m. You can use the same link and keep joining us daily. And we have shared registration link along with the joining message. If any of you have not received or missed it, I'm sharing it again in the chat box, which is same for every day on weekdays. You can use it and bookmark it, and every day you can join with the same. You can register daily with the same link on weekdays and you can join. The basic eligibility criteria is register for the event, participate, provide feedback, and download your certificate from the website. So website links has also been provided in the registration form. You can visit the website and download your certificates from the website after prescribed time. So all details are available in the registration form along with the website links.
So excuse me. So this is Bhuneshwari. Hello, sir.
Yes, ma'am.
Sir, will you be sharing all these details on the chat and the WhatsApp group also, sir? Or should we copy it now itself?
No, the actually feedback is only available.
Feedback is done, sir. Feedback is done for tomorrow's link and all those things. Whatever we have shared on the chat, should I copy or is it going to be shared in that Tech and Positive group?
You can, yeah, even in that group, it has been shared.
Okay.
You can join in that group. We have shared a message in that you will find a WhatsApp group link. You can join that group where we post all the details regularly.
Okay, sir.
So, from that group, you can get. Even in that group also, we are posting. In case we missed it, you can always have that group joined so that we can post regular updates.
Okay, so thank you so much.
Thank you. Dear friends, quickly fill up the feedback form. Manasa, if you have completed your feedback, you can go ahead with vote of thanks.
A very good evening to one and all. I, Manasa, thank Dr. Ravindra sir, moderator and coordinator, for giving me this wonderful opportunity to propose vote of thanks and also to express my gratitude. First of all, we thank Dr. Ravindra sir, moderator and coordinator, and his team, Sri Holistic Health Foundation India, Sri Research Institute, Center for Arts, Sciences and Well-being, for giving everyone wonderful opportunity to gain loads of knowledge, and also organizing, inviting and conducting sessions in such an excellent manner, enjoying insights of national seminar today. Without their efforts, this couldn't have been possible. And also, I would like to thank all our valuable session speakers of the National Seminar on Dental Health and Hygiene, Well-being and Sustainable Development 2022 today. Dr. Jyoti Makar ma'am on the dental health and also the dental stages, and also highlighting the points about the stains and importance of enamels. It's been really very insightful session, ma'am. And the very next session speaker, Dr. Vidya Hari Iyer ma'am, regarding the history and evolution of dentistry and whatnot, many more topics and wonderful observational points and the innovations and enlightenments in a very detailed manner, and also regarding the dental council and the pros and cons of daily habitual actions, and good and bad about toothpastes and brushes, and many more personal experience has been shared by Dr. Vidya ma'am today. It's been really very insightful and knowledgeable session. Thank you, ma'am. And once again, I thank Dr. Ravindra sir and his team, Sri Holistic Health Foundation India, Sri Research Institute, Center for Arts and Sciences, Well-being, for this wonderful opportunity to propose vote of thanks and also to be a part of Azadi Ka Amrut Mahotsav celebrations and national seminar today. Thank you all.
Thank you everyone once again for joining us. So you can join tomorrow for the rest of the sessions. So see you all tomorrow at 2 o'clock. Take care. Good night. Once again, happy Christmas to all my our Christian friends. So thank you. Take care. Good night. We have shared website address also in the chat box. You can join the WhatsApp group or other channels by visiting website. All the details are available along with the instructions on how to download your certificates also, and what are the formalities that needs to be completed. So after filling the feedback form, you may leave the platform, and see you all tomorrow. Take care. Good night.